In 1854, a doctor in London did something that seems obvious today, but was considered radical at the time. Instead of trusting the leading medical theory of his era, he walked through the streets, personally mapped every single case of a deadly outbreak, and used that map to prove the entire medical establishment wrong. The disease was cholera, and at the time, the dominant belief among doctors was something called Miasma Theory, the idea that disease spread through bad air, foul-smelling vapors rising from waste and decay. It sounds absurd now, but it was the accepted scientific consensus taught in medical schools and used to justify public health decisions across Europe. Physician John Snow suspected something different, that cholera was spreading through contaminated water, not air. When a severe outbreak hit London's Soho district, killing over 600 people in a matter of days, Snow began an investigation that would later be recognized as one of the founding moments of modern epidemiology. He went door to door, interviewing families, recording exactly where each victim lived, and marking every single case on a hand-drawn map of the neighborhood. A clear pattern emerged almost immediately. The deaths clustered tightly around a single public water pump on Broad Street. Households that used water from other nearby pumps had dramatically fewer cases, even when they lived just as close to the outbreak center. In one striking detail Snow documented, a nearby brewery whose workers drank almost exclusively beer instead of water reported barely any cases at all, since the brewing process happened to eliminate the contamination entirely, without anyone involved understanding why at the time. Snow presented his findings to local officials and convinced them to remove the handle from the Broad Street pump, physically disabling it. Cases in the area dropped sharply afterward. Later investigation found that the well supplying that specific pump had been dug dangerously close to an old cesspit, allowing sewage contamination to seep directly into the drinking water supply for that entire section of the city. What makes this story genuinely foundational isn't just that Snow was right, it's how he proved it. Not through theory or authority, but through careful, systematic, door-to-door data collection, mapped visually and analyzed for patterns, a method that essentially didn't exist as a formal medical practice before this outbreak. Snow's map is still taught today as one of the earliest and clearest examples of using geographic data to solve a public health crisis, decades before germ theory itself was even widely accepted. It took a deadly outbreak and one doctor willing to walk the same streets his patients were dying in to permanently shift medicine away from guesswork about bad air and toward evidence. A shift the entire modern field of public health still stands on today.